Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Real glad that you could join us for another segment. I'm going to be speaking this evening with Dr. David Knight, Medical Director of Demeter Regeneration in Sydney, Australia, and he's joining us on the program to talk about the field of regenerative medicine, which uses the body's own cells and tissues to heal itself. This includes ovarian rejuvenation therapy. Welcome to Health Professional Radio, Dr. Knight.
Oh, thank you, Neil. It's a pleasure to be here.
Give our listeners a bit of your background, and then let's talk about ORT.
Sure. So I grew up in the midst of mainstream conservative medicine. I did OBGYN training and then became a fertility specialist working in the area of IVF, which I have been doing for the last 2.5 decades. Over the last 10 years, I started to concentrate on looking after women as they got older in IVF, and very quickly realized that this group of women responds in a very different way and, in fact, has ovarian function that is quite different to that of women that we would generally see in their 20s and 30s. And as part of that, came across a whole pile of women, obviously with, what people would say are failing ovaries or resistant ovaries. And with the information and the ideas that were coming out of some different countries around the world, spent a little bit of time beginning to look at ovarian rejuvenation therapy and some treatments around that to improve ovarian function.
We are going to talk about ovarian rejuvenation therapy a little bit more in depth, but what is rejuvenation therapy or regenerative medicine in the first place? How does the body use its own cells and tissues to heal itself with our help?
I think one of the really cool things about our body is that the potential's there, and the potential has always been there for it to use the components of the body to make it better, to rebuild, fix, etc. One of the problems that we've seen over a number of centuries and certainly over the last 100 years is that our lifestyle has shifted that ability enormously, and changes in the type of lifestyle we have, a more sedentary nature, and excess of fuel, the exposure to pollutions and things like that have set up quite an inflammatory response. And whilst our lifespan has extended, our health span certainly hasn't kept up with our lifespan. And so I can tell you Australian data, obviously, me being Australian, the average life expectancy is around 80, and Australia has one of the highest health spans in the world of around about 71. And so we're looking at spending about 12% of our life unhealthy. And some people, and it's at the end as well, which doesn't sound very cool. So regenerative medicine started with looking at using stem cells to regrow, rebuild, and a lot of these things were either outside the human body or looking at approaches to add these to the human body in certain conditions to improve outcomes. And in a few small areas we have managed to do that. And one of these areas obviously would be the treatment of malignant melanoma, which has, with vaccine, has been fascinating over the last number of years from where it was a couple of decades ago. However, we can also see different ways of going about it, and the biotech industry is looking really closely at senescent therapy, where we can look at using compounds to address senescent cell formation in the body and reduce that. And it appears that senescent cells are cells that are like zombie cells. They have reached the end of their ability to divide, and rather than just dying, they hang around and they create a negative environment. And these are increasingly seemingly to be involved in not only aging as a whole, but also the diseases associated with aging. And senescent cell formation is one of these particular issues. So killing senescent cells does two things. One, it reduces the environment that these senescent cells make. We call that a SAS, but it's a negative environment, and it turns good cells into senescent cells. By getting rid of these senescent cells, we can also enable the cells of that area to regenerate and grow under their own accord. So we're potentially seeing an enormous opportunity for aging human cell growth to be maintained for a much longer level.
Is that the technology used in ovarian rejuvenation therapy?
Well, it's one of the ones that I do, and it's one of the ones I add. And I think as part of what we're doing here, it's about improving the function of the whole body to improve things like the microbiome, the reprobiome, as part of this particular process. There's no point in having, the best fuel in the world if you're putting it into the worst engine. It's really important, if you're going to have a car that wins a race, to have all the bits of the car working in tune. Otherwise, it's just going to break somewhere and you're not going to get maximal outcome. So the components that I put together for this include intermittent fasting for NAD production, is an important part. I think sleep is incredibly important. These maximize microbiome. Foods, obviously, what people eat as well as when they eat them are important as well. So a Blue Zones type diet or a pesky Mediterranean diet. And then on top of that, senolytic therapy as a general approach, because it improves not only the whole body but also ovarian function. And then adding in some NAD booster supplements, for example, NMN and resveratrol, I think, are sensible as well. On top of that, there is then the use of ovarian PRP or perhaps ovarian fragmentation and autotransplantation, two techniques which are thought to activate dormant ovarian follicles. Both of these are surgical procedures. The first can be done either laparoscopically or transvaginally, and the second one is generally done laparoscopically. So there's quite a program that can be conducted around improving not only the individual's health, but also improving their ovarian function going forward.
I was under the impression that new eggs didn't develop in ovaries. There were a finite number, and if you can rejuvenate ovaries, is that what we're talking about? Rejuvenate them so that older women can have kids?
That's a really common perception, I think, and it's been around for more than 100 years, that we're born with all the eggs that we're going to have, and it really applies to mammals and other animals as well, and that at the end of the number of eggs that are of the menopause, all the eggs are gone, and that's it. A chap called Jonathan Tilley showed this clearly not to be the case with the discovery of progenitor germ cells or egg stem cells back in 2004 in mice and then subsequently in humans. And I must admit, I, for one, these days am part of a fairly large crowd that believe that the data is fairly set that egg germ cells exist or egg stem cells exist. Furthermore, Kawamura in Japan, who started the ovarian fragmentation process, he took biopsies of the ovaries, which he not only put back, but he also sent off. And in these women with premature ovarian failure, he clearly demonstrated histopathologically that there were eggs remaining within the ovarian tissue to varying degrees. Very rare, but they were there. And that on certain occasions, these could then be activated and form kids. And so he presented the first child in a paper in 2013 who was born to a woman previously diagnosed with premature ovarian failure. So, yes, that was, I think, the old view of what's going on. The newer data doesn't support that, and it opens a huge range of possibilities for us going forward.
Well, let's talk briefly about the Innovium ovarian rejuvenation procedure, how it is performed, and some of the benefits.
Innovium is using platelet-rich plasma, which is autologous, which means it's made from the individual. And so blood is drawn, and the blood is then prepared in a series of spins and tubes to get rid of most of the cells and contain really serum or plasma. And this is then inserted into the ovaries in one of two ways. It's either done through the vagina with a long needle, similar to the one that we use when we do egg collections for IVF, and varying amounts of this PRP is then put into the ovary. It can be difficult to do transvaginally, and sometimes the ovaries are very hard, and varying amounts are put in the papers from around about 1 mil to 4 mils in each ovary when they're seen. It can also be done laparoscopically. That provides a much clearer view, obviously, of the ovaries. The ovaries can then be grasped as well, and the PRP can easily be seen going into the ovary, and generally between 4 and 6 mils is injected if the ovaries are seen laparoscopically, and counter-traction is applied. Both of these techniques are seemingly, from the published data, similar in their effectiveness, and there are a series of papers over the last 2 years that have come out reporting pregnancies in women who had previously not conceived, or again who had premature ovarian failure diagnoses.
It sounds extremely exciting and promising. Where can our listeners get some more information about this experimental procedure?
That's a really good question. The places around that do this will have some in the States. There are a number of IVF units around the country that do ovarian rejuvenation. Around 3 or 4 years ago when I started doing this, there were about 4. Last count about a year ago, I saw about 25. So there are a number around. Googling ovarian rejuvenation is going to get a series of responses.
And as far as Demeter is concerned, what about your website, Demeter Regeneration?
That's right. Certainly people want to see the range of things that we do, because we don't always just confine ourselves to ovarian rejuvenation. I want to live longer in a good world, and that's what I want to share with people. So there are approaches out there that can, I think, make our lives healthier and happier. And that's what I want to share.
And that website would be www.demeterregeneration.com.au.
That'd be great. Thank you very much, Neil.
All right. Well, thank you, David. It's been a pleasure speaking with you.
You have a great day.
You as well. You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. David Knight, Medical Director at Demeter Regeneration in Sydney, Australia. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure to subscribe to our YouTube channel at youtube.com, Health Professional Radio.